Welcome to Darlington Maternity Unit. We want to offer you the best possible experience for you and your family, and we focus on family-centred care. When you arrive at the hospital, there are parking bays at the front of the hospital and they'll allow you 15 minutes. You come in through the accident and emergency entrance 24 hours a day and you make your way to the back of the hospital where you'll get into the lift and come up to the 6th floor. When you come out of the lift, this is where you will arrive. It is a locked ward for security reasons, and to gain entry you'll need to press the buzzer.
Hello, can I help?
Hello, it's Barbara, the ward sister. Can I come in?
Just come through.
Infection control is very important on a maternity unit. We do have hand washing facilities and also hand sanitising units on the entrance to the ward, and we encourage all patients, visitors and staff to use those between every patient contact. We would appreciate if you could ring ahead just to let us know that you're coming. You can always speak to a midwife 24 hours a day. The midwife and yourself, with a telephone conversation, will decide when the best time is for you to come into hospital. This is our midwife station, the hub of the labour ward. Once you come onto the ward, you'll be met here by your midwife, taken down to the room and settled in. Once you arrive onto labour ward, your partner will be asked to go back down and move the car into a parking bay, and we'll give you an exemption certificate. This is one of our labour rooms. We try and make the labour rooms as homely as possible. In each labour room we have televisions, we have a telephone, we also have a radio compact disc player just to aid in people's comfort. Also in this room we do have a bed, a labour bed, but in actual fact we can manoeuvre it into different positions, and this is just one example, just to aid the comfort, although we do encourage people to be mobile while they're in labour. Also in the room we do have monitoring equipment for monitoring baby's heartbeat. We can either do it manually, or if labour's become more high risk, we can use an electronic machine. Also over here we have what's called a resuscitator, and in here is basic equipment for giving babies a breath of oxygen or clearing out the airways should they need it at birth. We do encourage 2 people to come to support you in labour, but it's very much an individual choice. Sometimes you may only want 1 person to come with you, but really 2 is a maximum. Adjacent to one of our labour rooms is the pool room. We offer a variety of pain relief methods in labour, but using water is a very effective way. It's a natural pain relieving method which is very successful in labour. Normally we would have this room, the lights would be dimmed, we would have soft music playing, and it does provide excellent pain relief. You may choose to deliver in the pool, or you may decide to get out of the pool and deliver on the bed, or actually standing up. Whatever position suits you, we'll support you whatever you choose. It is a locked ward. Also, every baby is tagged with an electronic security tag so that we can track movement of babies on our unit. We also have 2 recovery rooms. We have our own operating theatre here on labour ward. This is where we do our elective caesarean sections most days of the week. Also, it's available in emergency 24 hours a day should the need arise. Everybody's care is individual. You could normally expect to be on labour ward for 2 to 3 hours following a normal delivery before you're transferred over to the postnatal ward. Sometimes you may choose to go home after 6 hours, and we may keep you on labour ward for those 6 hours and then just transfer you straight home. You'll be transferred over here, accompanied by your midwife, who will introduce you to the staff. We have a mixture of 3-bedded bays and side wards. Usually you would stay between 6 hours and 48 hours after the birth of your baby. where we'll help you to care for your baby and support you in whichever method of feeding you choose. What we think is really important is skin-to-skin contact with your baby, regardless of the method that you're feeding. It is very important to help you bond with your baby. It also keeps your baby warm and feels secure. It regulates the heartbeat and maintains the temperature. Well, whilst you're on labour ward, it still is a no visiting policy, and you can have your 2 birthing partners with you. Once you move over onto the postnatal ward, visiting is from 8 in the morning until 9 at night for partners and their own children. For other members of the family, it is 2 till 3 on an afternoon and 6 till 7 at night. We do try and encourage a maximum of 2 to 3 visitors per bed. Our aim is to give the best possible care, family-centred care, and hopefully to give people the best experience possible at a very exciting time in their life. We're very proud of the unit, and we hope that you'll choose to have your baby here with us.